NMCCBT questions and answers. Question number 376. Mr. Bond's daughter rang and wanted to visit him. She told you of her diarrhea and vomiting in the last 24 hours. How will you best respond to her about visiting Mr. Bond? Option A. Allow her to visit and use alcohol gel before contact with him. Option B. Visit him when she feels better. Option C. Visit him when she is symptom-free after 48 hours. Option D. Allow her to visit only during visiting times only. The correct answer is option C. Visit him when she is symptom-free after 48 hours. Question number 377. Which check do you need to carry out before setting up an enteral feed via a nasogastric tube? Option A. That when flushed with red juice, the red juice can be seen when the tube is aspirated. Option B. That air cannot be heard rushing into the lungs by doing the whoosh test. Option C. That the pH of gastric aspirate is less than 5.5, and the measurement on the NG tube is the same length as the time insertion. Option D. That pH of gastric aspirate is more than 6.0, and the measurement on the NG tube is the same length as the time insertion. The correct answer is option C. That the pH of gastric aspirate is less than 5.5, and the measurement on the NG tube is the same length as the time insertion. Question number 378. If a patient requires protective isolation, which of the following should you advise them to drink? Option A. Filtered water only. Option B. Fresh fruit juice and filtered water. Option C. Bottled water and tap water. Option D. Long life fruit juice and filtered water. The correct answer is option D. Long life fruit juice and filtered water. Question number 379. An adult woman asks for the best contraception in view of her holiday travel to a diarrhea-prone areas. She is currently taking oral contraceptives. What advice will you give her? Option A. Tell her to abstain from having sex because of HIV. Option B. Tell her to bring lots of contraceptives because it will be expensive. Option C. Tell her to use other methods like condom because diarrhea lessens the effects of oral contraceptives pills. Option D. Tell her to continue taking her usual contraceptives. The correct answer is option C. Tell her to use other methods like condom because diarrhea lessens the effects of oral contraceptives pills. Question number 380. Dehydration is of particular concern in ill health. If a patient is receiving IV fluid replacement and is having their fluid balance recorded, which of the following statements is true of someone said to be in positive fluid balance? Option A. The fluid output has exceeded the input. Option B. The doctor may consider increasing the IV drip rate. Option C. The fluid balance chart can be stopped as positive means good. Option D. The fluid input has exceeded the output. The correct answer is option D. The fluid input has exceeded the output. Question number 381. How can patients who need assistance at meal times be identified? Option A. A red sticker. Option B. A color serviette. Option C. A red tray. Option D. Any of the above. The correct answer is option D. Any of the above. Question number 382. A patient develops gingivitis after using an artificial denture. It is characterized by option A. White patches on tongue. Option B. Red shiny patches on tongue. Option C. Red shiny patches around the palate of tooth. The correct answer is option C. Red shiny patches around the palate of tooth. Question number 383. A patient had been suffering from severe diarrhea and is now showing signs of dehydration. Which of the following is not a classic symptom? Option A. Passing small amounts of urine frequently. Option B. Dizziness or lightheadedness. Option C. Dark-colored urine. Option D. Thirst. The correct answer is option A, passing small amounts of urine frequently. Question number 384. Causes of gingival bleeding. Option A, pore removal plaque. Option B, pore flossing. Option C, poor nutrition. Option D, poor taking of drugs. The correct answer is option A, pore removal plaque. Question number 385. The client reports nausea and constipation. Which of the following would be the priority nursing action? Option A, collect a stool sample. Option B, complete an abdominal assessment. Option C, administer an anti-nausea medication. Option D, notify the physician. The correct answer is option B, complete an abdominal assessment. Question number 386. According to law in England, UK, when you faced with a situation of emergency, what is your action? Option A, should not assist when it is outside of work environment. Option B, law insists you to stop and assist. Option C, you are not obliged in any way but as a professional duty advises you to stop and assist. Option D, do not involve in the situation. The correct answer is option C, you are not obliged in any way but as a professional duty advises you to stop and assist. Question number 387. A patient underwent an abdominal surgery and will be unable to meet nutritional needs through oral intake. A patient was placed on enteral feeding. How would you position the patient when feeding is being administered? Option A, sitting upright at 30 to 45 degrees. Option B, sitting upright at 60 to 75 degrees. Option C, sitting upright at 45 to 60. Option D, sitting upright at 75 to 90 degrees. The correct answer is option A, sitting upright at 30 to 45 degrees. Question number 388. What is respiration? Option A, the movement of air into and out of the lungs to continually refresh the gases there, commonly called breathing. Option B, movement of oxygen from the lungs into the blood, and carbon dioxide from the lungs into the blood, commonly called gaseous exchange. Option C, movement of oxygen from blood to the cells, and of carbon dioxide from the cells to the blood. Option D, the transport of oxygen from the outside air to the cells within tissues, and the transport of carbon dioxide in the opposite direction. The correct answer is option A, the movement of air into and out of the lungs to continually refresh the gases there, commonly called breathing. Question number 389. What is the most accurate method of calculating a respiratory rate? Option A, counting the number of respiratory cycles in 15 seconds and multiplying by 4. Option B, counting the number of respiratory cycles in 1 minute. One cycle is equal to the complete rise and fall of the patient's chest. Option C, not telling the patient, as this may make them conscious of their breathing pattern and influence the accuracy of the rate. Option D, placing your hand on the patient's chest and counting the number of respiratory cycles in 30 seconds and multiplying by 2. The correct answer is option B, counting the number of respiratory cycles in 1 minute. One cycle is equal to the complete rise and fall of the patient's chest. Question number 390. What should be included in your initial assessment of your patient's respiratory status? Option A, review the patient's notes and charts to obtain the patient's history. Option B, review the results of routine investigations. Option C, observe the patient's breathing for ease and comfort, rate and pattern. Option D, check for any drains. Option E, all of the above. The correct answer is option E, all of the above. Question number 391. While assisting a client from bed to chair, the nurse observes that the client looks pale and is beginning to perspire heavily. The nurse would then do which of the following activities as a reassessment? Option A, help client into the chair but more quickly. Option B. Document client's vital signs taken just prior to moving the client. Option C. Help client back to bed immediately. Option D. Observe client's skin color and take another set of vital signs. The correct answer is option C. Help client back to bed immediately. Question number 392. Prior to sending a patient home on oxygen, healthcare providers must ensure the patient and family understand the dangers of smoking in an oxygen-rich environment. Why is this necessary? Option A. It is especially dangerous to the patient's health to smoke while using oxygen. Option B. Oxygen is highly flammable and there is a risk of fire. Option C. Oxygen and cigarette smoke can combine to produce a poisonous mixture. Option D. Oxygen can lead to an increased consumption of cigarette. The correct answer is option B. Oxygen is highly flammable and there is a risk of fire. Question number 393. What do you need to consider when helping a patient with shortness of breath sit out in a chair? Option A. They should not sit out on a chair. Lying flat is the only position for someone with shortness of breath so that there are no negative effects of gravity putting pressure in lungs. Option B. Sitting in a reclining position with legs elevated to reduce the use of postural muscle oxygen requirements, increasing lung volumes and optimizing perfusion for the best VQ ratio. The patient should also be kept in an environment that is quiet so they don't expend any unnecessary energy. Option C. The patient needs to be able to sit in a forward-leaning position supported by pillows. They may also need access to a nebulizer and humidified oxygen, so they must be in a position where this is accessible without being a risk to others. Option D. There are two possible positions, either sitting upright or side lying, which is used and is determined by the age of the patient. It is also important to remember that they will always need a nebulizer and oxygen, and the air temperature must be below 20 degrees Celsius. The correct answer is option C. The patient needs to be able to sit in a forward-leaning position supported by pillows. They may also need access to a nebulizer and humidified oxygen, so they must be in a position where this is accessible without being a risk to others. Question number 394. Joy, a COPD patient is to be discharged in the community. As her nurse, which of the following interventions will you encourage him to do to prevent progression of disease? Option A. Oxygen therapy. Option B. Breathing exercise. Option C. Cessation of smoking. Option D. Coughing exercise. The correct answer is option B. Breathing exercise. Question number 395. Lisa, a working mother of 3, has approached you during a recent attendance of her daughter in accident and emergency because of an acute asthma attack about smoking cessation. What is your most appropriate response to her? Option A. Smoking cessation will help prevent further asthma attack. Option B. Referral can be made to the local NHS Stop Smoking service. Option C. Discuss with her the NICE recommendations on smoking cessation. Option D. It is not common for people like her to stop smoking. The correct answer is option B. Referral can be made to the local NHS Stop Smoking service. Question number 396. What are the principles of gaining informed consent prior to a planned surgery? Option A. Gaining permission for an imminent procedure by providing information in medical terms, ensuring a patient knows the potential risks and intended benefits. Option B. Gaining permission from a patient who is competent to give it, by providing information, both verbally and with written material, relating to the planned procedure, for them to read on the day of planned surgery. Option C. Gaining permission from a patient who is competent to give it, by informing them about the procedure and highlighting risks if the procedure is not carried out. Option D. Gaining permission from a patient who is competent to give it, by providing information in understandable terms prior to surgery, allowing time for answering questions, and inviting voluntary participation. The correct answer is option D, gaining permission from a patient who is competent to give it, by providing information in understandable terms prior to surgery, allowing time for answering questions, and inviting voluntary participation. Question number 397. The following must be considered in procuring a consent, except option A, respect and support people's rights to accept or decline treatment or care. Option B, withhold people's rights to be fully involved in decisions about their care. Option C, be aware of the legislation regarding mental capacity. Option D, gain consent before treatment or care starts. The correct answer is option B, withhold people's rights to be fully involved in decisions about their care. Question number 398. A client is brought to the emergency room by the emergency medical services after being hit by a car. The name of the client is not known. The client has sustained a severe head injury, multiple fractures, and is unconscious. An emergency craniotomy is required. Regarding informed consent for the surgical procedure, which of the following is the best action? Option A, call the police to identify the client and locate the family. Option B, obtain a court order for the surgical procedure. Option C, ask the emergency medical services team to sign the informed consent. Option C, transport the victim to the operating room for surgery. The correct answer is option D, transport the victim to the operating room for surgery. Question number 399. Accurate post-operative observations are key to assessing a patient's deterioration or recovery. The Modified Early Warning Score, MUSE, is a scoring system that supports that aim. What is the primary purpose of MUSE? Option A, identifies patients at risk of deterioration. Option B, identifies potential respiratory distress. Option C, improves communication between nursing staff and doctors. Option D, assesses the impact of pre-existing conditions on post-operative recovery. The correct answer is option A, identifies patients at risk of deterioration. Question number 400. A patient has just returned from theatre following surgery on their left arm. They have a PCA infusion connected, and from the admission, you remember that they have poor dexterity with their right hand. They are currently pain-free. What actions would you take? Option A, educate the patient's family to push the button when the patient asks for it. Encourage them to tell the nursing staff when they leave the ward so that staff can take over. Option B, routinely offer the patient a bolus and document this clearly. Option C, contact the pain team anesthetist to discuss the situation and suggest that the means of delivery are changed. Option D, the patient has paracetamol QDS written up, so this should be adequate pain relief. The correct answer is option C, contact the pain team anesthetist to discuss the situation and suggest that the means of delivery are changed.